Welcome. I'm visiting with Dr. JaDean Anderson, who is a chiropractor. And one of the things I'd like to ask you is, what are the different methods of chiropractic?
There are a huge variety of methods within chiropractic. There's basically different techniques done by hand, and then there's other techniques that use an instrument that actually performs the adjustment. Some techniques range from adjusting just in the neck, some just adjust the lower back, and the technique that I use is called Gonstead, and it's a full spine technique, so we adjust anywhere within the spine, and it's done by a hands-on adjustment.
You do manual adjustment.
Yep, and within the manual adjusting, what helps us be able to locate the area that needs to be adjusted, we use a heat sensing instrument. It measures temperature from one side of the spine to the other. And within a normal or perfect relationship, the temperature will be the same on both sides. And when there's an area that is a problematic area, the temperature will vary from one side to the other. So it helps us locate the problem that the patient has within their back, and then helps us monitor when they need to be adjusted and when they don't need to be adjusted, which is very important as well.
Have you been using this all along, this heat sensing method?
Yep, it's part of the criteria or approach of finding the patient's problem. We run the scope down their back, is what we call it, the heat sensing instrument, and then after we locate the certain areas of problem, we then do palpation or use our hands to move the patient around to feel how the body's moving, feel areas of tenderness, and then within that we look at an x-ray to help locate which way the bones have moved, so then we can properly realign the person's misalignments.
So your method is to treat the entire spine. Are there different methods that just treat the neck or the lower back?
Yes, there's certain techniques, well actually quite a few different techniques that have different ways that they treat just the neck, and that's, it's good, but it's a little bit different approach. They look at treating the neck to help with low back problems or all of your problems. I guess.
Do you feel you miss a lot by not treating the entire spine?
I feel that way, and but I do understand that some cases a neck problem can result in some low back issues because the entire spine is one unit. So I understand that just as much something above can affect something below as something below can affect something above.
Are there some chiropractors, you say, that use a technique that's called the activator, where it's a tool?
It's just a small little tool where they can set it to different amounts of pressure or force that's being applied, and it's a small area that the force is sent through, and they can just pull kind of like a trigger, and it allows the force to be applied through this small area to the desired region within the person's spine.
So is that putting the vertebrae back into place? But in a faster way, or?
It depends on the person and the problem. I would say maybe not necessarily quicker than by hand or more efficiently or less efficiently. It is very case specific and patient specific.
Okay, so it is just one of the other techniques.
Yep.
And you don't use that one?
No, I do not.
Okay. Thank you, Dr. Anderson.
Thank you.